everybody. This is Alexa Tinsley. I'm the Director of Programs here at Jett Foundation. Thank you all for joining us today for our community webinar series on advocating for yourself during the transition process. As usual, we're going to get started in just a few. We're going to allow people to hop on. We do have quite a few hopping on with us this afternoon. But while everybody is logging on, if you are comfortable and willing, please share in the chat your name, where you're from, and you or your child's age. And that would be wonderful. And we'll be right back. Where did it go? All right, it looks like people are hopping on. Okay. All right, looks good. Hi, everybody. Again, I am Alexa Tinsley. I'm the Director of Programs here at Jett Foundation. Thank you all for joining us today for our community webinar series on advocating for yourself during the transition process. We are very excited to have you here, and we thank Dr. Natalie Truba for her second webinar this year with us. We really appreciate you being here, making it possible, and sharing your knowledge and expertise with the community. For those of you who don't know her already, Dr. Truba is currently an attending psychologist at Nationwide Children's Hospital and is primarily responsible for inpatient psychological behavioral health care needs of patients managed by complex care, neuromuscular, and/or physical medicine rehab teams. So before we get started, I do just want to mention a few things. If this is your first webinar of our webinar series, we do offer these throughout the year. They are recorded and are shared later just in case anything happens, electricity goes out, you're not able to be on the whole thing. If you know anybody that wasn't able to attend, it'll also be available to them after the fact as well. So we will share that with you after, when it goes up and after this event, along with a survey. So the presentation today will be about 40 minutes, and then after we will be answering questions, or not we, Dr. Truba will, and I'll be reading them, but she'll be answering questions at the end. There is a Q&A box at the bottom, for me it's bottom right corner of your screen, and we will be taking questions through that portal. We do try to monitor the chat and see if any questions do come in there. So we will try to catch anything that comes in through the chat, but we do primarily look at that Q&A box for those questions. If you do have questions during the presentation, please feel free to put those in as well, and we'll try to get to them during the presentation. If not, we'll get to them during the Q&A. If there are any questions that we don't get to, we will we'll get those to Dr. Truba at the end and hopefully get those answered for you. So with that, we will, I will say bye for now. I will go off camera and I will hand it over to Dr. Truba.
Great. Thank you, Alexa. I'm going to share my screen. Just give me one moment. All right. Can you all see? Can you all see that?
Yep.
Just moving. Gotta move on screen so it looks like I won't be looking at you. Cool. All right. Well, thank you, Alexa, for that awesome introduction. Again, I am Natalie Truba. I'm a pediatric psychologist at the Nationwide Children's Hospital in Columbus, Ohio. I work with a lot of boys and men with Duchenne and their families, and are some of our rare bird manifesting female carriers. And I'm excited to be with you to talk about something that I'm very passionate about, which is helping our men transition from boys to adolescents to men, and really independent men, and being able to live a life of quality and live a life that we want. So I kind of, when I was putting this together, it's different than a lot of my talks in that it's very like there's a lot of blend. Like sometimes I'll be talking directly to the men and the boys, and sometimes I'll be talking directly to parents. And so I will try to do my best to delineate that. So I'm going to start off by just kind of going over broadly what the actual standards of care for adult transition are. And so in 2008, in the Lancet, Bernkrant et al. Published these standards of care that are the most up to date and the most current that we utilize, right now. And part of that was thinking about adult care and what are we doing to support our men as they live longer and live further into adulthood, to live lives that are rich, fulfilled, and promote independence and autonomy. And so as you look at this, right, there's like a lot of pieces that go into this, and they're all kind of big pieces, right? So when you're thinking about things like housing, right, like not only, type of housing, but what kind of technology is needed? What sort of modification? Am I staying at my parents' house? Do I want to live more independently? Transportation, things like how do I get transported? Do I need to maybe find resources for a second vehicle? Do we need to modify my parents' vehicle? Are there public transportation options that I would like to utilize, be aware of? Healthcare. What is your understanding of your healthcare needs? How medical literate are you? Which means, like, do you actually understand the information that is being taught to you, or that being talked about? How are you understanding your transition from pediatric care to adult care, and that shift from family centered care, which is where the whole family kind of has equal say, like your parents are involved, you're involved. If you want to bring your grandparents, like they're involved, and the doctors are talking to everybody, to patient centered, where it's like those people aren't really involved anymore. Like you can involve them if you want, but we're not really going to involve them as much, because like you're really the only one holding the power for you at that point. And that is a big shift in care. Other things like, do I need certain documents completed so that I can keep myself safe, or kind of make sure that my needs are being met in a way that I want them to be met? Other things like that. We think about daily activities of daily living. We start to think about, how do I maybe want to live? Who do I want taking care of me? Do I want my parents to be my primary caregiver? Is that starting to become a barrier to things like dating or getting out of my house or doing other things that maybe my parents aren't super supportive, but are really a part of kind of going through young adulthood? Um, do I need guardianship, or am I a parent that needs to be thinking about guardianship for my child? Um, Education, employment. What are my interests? What sort of do I see myself doing? To find value, to contribute, to bring joy, to make money, right? Do I need vocational training in order to do that? Do I need to go to college? Do I need something different? And then things like relationships. How do I make relationships, and how do I connect with others? Do I have the social skill set and the assertiveness skill set and the, bravery skill set needed to kind of get out there and make friendships and form relationships once I'm like outside of secondary or primary school, where your friendships are really built on proximity, right? Like you grew up together, you live in the same town, you go to the same school, you're in the same class, so you're friends. And once that gets harder and people are moving away, those relationships can kind of change, and it's a lot harder. It's different to make friends when you're an adult. And so these are all really big things. It's not something that we can just wave a magic wand and be like, oh yeah, like the transition adulthood's fine, it's done, we've wrapped all this up in a day, right? These are things that take time and actually a lot of thinking about and planning. And so as we think about standards of care and transitioning to adulthood, there's a few things that are just kind of like at a bare level that we really just want to all kind of make sure we're on the same page of. One is that transitioning to adulthood is an inevitable part of life, or at least we hope it is, right? That's a good thing. We should want to become adults, and we will become adults if we survive to adulthood. And it's stressful. It's stressful to become an adult. It's stressful to take on the ownership and responsibility for an adult for anybody. It is even more stressful when you have Duchenne or another chronic chronic condition, or something that is mobility limiting, right? Where you need kind of help and support and dependent on other people. And so those are real facts. Okay. And we have to acknowledge that it is harder. And that might mean we have to put more effort into it intentionally. And we maybe have to really kind of get ahead of some things, because transitioning is a process. Okay. It's not a single event. It's not like a transfer where you're like, okay, I transferred my care. Today I was in this pediatric neuromuscular center, and then the next time I come to a visit, I'm in an adult neuromuscular center. And that would be a transfer, like we transferred from here to here. Transition is a process. It occurs slowly over time. And the reason we talk about transitioning to adulthood as a transition and not a transfer is that because there's no way that without proper planning, organization, and kind of like scaffolding of skills needed to do that, that's going to be successful in a single time event, right? Like we can't ever work on these things and then transfer to adulthood and be like, I don't know, I just think it'll be fine. I've never learned how to do these things, but I'm just going to figure it out today. No, that's not how it goes. And so we really want to be thinking about starting these conversations young. And so the recommendation is to start these conversations around 13 or 14 years of age, and sometimes even younger, depending on, a child's maturity level, their developmental capacity, maybe sometimes a little later, but for every kiddo, as long as they're able to participate and they can engage in kind of helping make decisions for themselves, we want to start that really young, because this is where we're starting to identify those foundational skills that we need to kind of build upon, right? Things like being able to speak up, being able to ask a question, being able to understand aspects of your medical care. And this is challenging because parents are constantly needing to balance parental involvement and support, right, with allowing independence. And that is a really challenging place as a parent to find yourself in, especially when you have a child with Duchenne or Becker muscular dystrophy. One, because this means that at times it is knowing and allowing your child to make mistakes that might cause them pain, which we do not do well with as parents, right? Because your whole job is to keep your kids safe and to help them navigate that. But those are really sometimes powerful learning experiences. And the younger and the earlier we learn, the less harmful and painful those learning experiences actually are. And so it's really important that we are helping support that balance as a community around, we have to have these conversations. We have to start to allow some loosening up of places we can be independent, or allow some assertiveness and some choice to be made, so that we can learn how to do that as best as possible. And if we don't practice it and sometimes not do great at it, we're not going to learn. And so that is a real challenge, and with transitioning to adulthood, and that has to start as early as possible. So when we think about transition, like why, like what's the big deal? Why do we need to think about this? And so let's step back and kind of approach it from like, what are my goals in life? Like, how are the ways that I'm thinking about being an adult? Like, is it all cracked up? All it's cracked up to be, right? Well, your goals are going to be individually decided. Different people are going to have different goals. So what person A's goals are might be very different than person B's goals. And that's okay, right? That is okay. It is not up to me to tell you what your goals are, or your parents, or your teachers, or your friends, or your religious leaders, or your coaches, or your grandparents, or your aunts and uncles, or your cousins, or anybody. It's up to you to decide what your goals are. All those people I listed, right? They can certainly help provide perspective and guidance and encouragement and things to think about and consider, and understanding of yourself through feedback and insight and shared experience, right? And they might actually also help you understand yourself a little bit, in the sense of like, well, this is sort of a theme for you versus something that seems to evolve and change over time. And so helping understand yourself through other people can be really powerful when it comes to like thinking through and understanding what maybe is important and what are the things that you want to work toward. And as we approach that, we want to really be thinking and anchoring ourselves in our values. Because what we know that is, regardless of what people go through, when we live a life that is values consistent, our mental health is better, our quality of life is better, our functioning is better, regardless of the stressors and the hardships and the things that are going on that are outside of our control. And so when I say values, I mean the things that are guiding principles and how we make choices and we behave. Not what we want, right? So like, I want to be wealthy is one I hear a lot. Like, that's an outcome. Okay. You might get there by doing things like, I like to live living frugally under my means and not being stressed by money is a value of mine. If I'm making choices that are frugal and minimal, then I am happy. That's kind of where I like to function. And over time, that might result in wealth, right? But it might not. And so the outcome of I have wealth isn't the goal, right? The goal is to live our values consistency, which is, I like to live frugally and minimally, right? Because that is what brings me joy and makes me happy. It helps me not feel overwhelmed in my space. Okay. And that way, if you don't get wealthy, like, we're still lived a life that we can look ourselves in the face and be like, I did right by me in the mirror. You can be like, this is okay. I make good choices. I'm okay with these choices. So understanding your values is really important. And talking through other people that know you well helps you understand your values. Because then you start to think, what's important from a quality versus quantity standpoint in my life, right? There are things that I'm going to do that are going to add a lot of quality, and there's things I'm going to do that maybe will add a lot of quantity, right? Likewise, there's things that maybe will take away some quantity and take away some quality. And there are people, right, that land on really far each end of that spectrum, and there are, people more in the middle, kind of shift, right to the left. And all of those are okay places to be. Again, it's not anyone's job but yours to determine what is quality and what is quantity, and how do you want that to look? But if we don't understand our values and we don't understand our goals, it's really hard to understand how I'm making choices for my quality, for my quantity, and to think through that balance. Because at the end of the day, we want to alleviate our personal stress and distress related to aging, related to becoming an adult, related to the things that become a little bit scarier when you're an adult and your parents are not there to kind of own and manage all of the things. This also, though, having this sense of stuff reduces parent distress, right? And their stress, which is also very important, because their job is to help guide and support. And if they aren't aware of or familiar with how you think about your goals and your quality and your quantity and your values, how are they supposed to help guide and shape and parent you into adulthood, right? The other really big thing here about goals is it really helps from a safety and vulnerability protection standpoint. So what we know from the literature is that when we have physical or cognitive disability, the rates or the chances of being neglected or abused or taken advantage of or kind of victimized are much higher, right? And that's because people are horrible, and if you're not able to protect yourself, they'll take advantage of that. And so there's ways that things that we can do to kind of keep ourselves safe and keep ourselves in a position that we're not overly vulnerable or overly exposed to risks. But if we don't plan and we're not intentional and we don't know our goals, we don't know our values, and we don't know what we want, it's really easy for other people to kind of take that over and put things in place that maybe aren't in our best interest, don't serve us really well, but maybe serve them. And we don't want that. And so there's really, really important here to thinking about how do we get through adolescence, early childhood to adolescence to adulthood in a way that keeps us safe. Because at the end of the day, we want to preserve autonomy and we want to support independence. And so autonomy is free will, like your ability to make decisions that you want to make, to do the things you want to do, not because you're forced to do them, right? So if we force you to do something, we'd say you don't have autonomy. With Duchenne and Becker, it's challenging, right? Because from an independent standpoint, it's hard to support full independence. It's like impossible. So we don't want to make that the goal, because there are things you need help with, right? Especially when you're older and maybe less mobile. That doesn't mean you shouldn't have independence, right? We just have to be realistic around the fact that you're not going to have 100% independence, but you should have autonomy, right? The goal is autonomy, making autonomous decisions while needing some dependent help, but in other places, being fully independent. And it's that balance that can get tricky. But again, when we know our goals and we know what's important, it helps the people that care about us, like our parents, our caregivers, our friends, our family, help us navigate what our decision making on what do we need to do, right? What do I want to do with housing? What do I do with transportation? What do I do with healthcare? What do I do for a job? But advocating is really hard, right? And it's hard for a lot of good reasons. One, it's often a new skill for people, and it's a developing skill. And it's one of those skills you only develop through doing it, and which means you're always kind of putting yourself in an uncomfortable position. So you have to have pretty good assertiveness skills. And assertiveness skills are hard for a lot of people to develop. When you have Duchenne and your brains and bodies don't regulate super great together, it can be even harder, right? Because it's that big of much more of a hill to kind of get over to advocate or to do that thing. You have to manage that internal experience really well in order to advocate and assert in an appropriate and adaptive way. Because if you are assertive in a way that's aggressive or mean, that's not necessarily going to serve the function you want it to serve, right? And so there's an art to advocating and to asserting yourself in situations when you need to, but it's an art and it's a skill that needs to be learned. Otherwise, we are not as safe, we can't get our needs met, and we're not going to be able to advocate for ourselves. You also don't know what you don't know. So sometimes it's just hard to advocate for yourself because you're like, I don't even know what I should be advocating for myself about because I don't know these things, right? And so oftentimes when people don't have questions, it's often because in medical visits, for example, they don't necessarily understand what they don't know. And if you don't know what you don't know, it's really hard to be like, I don't know this thing, right? It's impossible. And so developing skills, like I go to the doctor and I say, what are questions that you would be asking if you were me? What don't I know? Like, what are the things that I should know or should be asking? And a lot of times medical providers they will tell you, like, I would want to know this, I'd want to know this, or, I think you have all the information, right? But it's learning those ways that you feel comfortable asking, like, are there things that I don't know that you think I should know, but if I don't ask, you won't tell me? Which is actually a really important thing to know about medicine, is that happens sometimes, right? Because it's not something that is going to harm you necessarily, that they have to tell you legally, but it's something they would want to tell you. But if you don't bring it up, then we're like, okay, well, maybe, maybe now is not the best time. But if you don't know to bring it up because you didn't know about it, then that would be an opportunity for us to kind of educate you around things that you should be thinking about, formulating questions around, and how to approach these visits in the future. It's also super hard to fail, right? Or lose. And when you're learning a skill, that is how we learn. When you're learning a skill that requires you to engage with another person and requires sociability and requires this like overcoming of anxiety in a social situation as well as a performance situation, that's really hard, because it's going to be a lot of things that don't feel good, right? It might not go well. They might not understand you. Maybe you didn't describe it well enough. Maybe they're not listening well enough. Whatever the issue is, it's still uncomfortable. And so we want to get to a place of like, I'm learning, right? And learning means at times things don't go well. And actually, that's how we learn. So we're either winning or learning. Sometimes we win and we say, like, yeah, that felt good. I'm going to do that again. I'm going to replicate that. And other times we don't win and we're like, ooh, I'm going to step back from that. Like, this makes me not want to do this again. And I know that I've had other times it's gone okay. What can I take away from this? What can I learn? What is a skill or something I can try different and next time, right? And that way, right, we can kind of reorient ourselves and ground ourselves that this is a process. I'm just learning a skill. Okay. It's going to feel this way. I didn't do anything wrong. And all I can do is learn from this and continue to get better and improve upon this new skill I'm developing, which is asserting and advocating for myself. And we do this because it's going to help us manage patterns of avoidance. So when we get nervous or we perceive something didn't go well, the natural human instinct is to like not want to do it again, right? And when your body doesn't regulate well and your brain doesn't regulate well, that's a slippery slope, because a lot of things are going to sometimes feel bigger than they would, maybe for somebody else. And so we have to be very mindful of like not allowing ourselves to overly avoid in order to help ourselves feel comfortable. We have to actually push ourselves into a bit of uncomfortability in order to actually learn and allow ourselves opportunity to kind of move past some spaces of kind of gaps in how we currently function as a community, with who is advocating, who is pushing, who is putting themselves in these positions to kind of get some of these needs met. Because it's not the men, it's often their parents, right? And they're like, oh, it stresses them out, makes them anxious, so we don't make them do it. Yeah, like it would make me anxious too, and I don't have Duchenne. And so like part of it is accepting like they're parts of normal developmental learning. When you get to be an adult, like there are times it just feels bad, right? Because it's stressful and there isn't anyone there to just rescue you. And so we need to kind of lean into this avoidance and kind of really work on minimizing it for ourselves. The other big thing is that it takes a lot of motivation and effort to advocate for yourself. And if it takes you so much motivation just to put yourself in that situation because we don't regulate well, right? Then that means that it's going to take so much more effort as well. And sometimes you just don't have a lot of motivation, right? So then we're using all of our effort to motivate ourselves, which doesn't leave a lot of effort left to do the thing, right? And this is a really important concept, because it might be like, I might need a lot of effort to motivate myself in a space. So then I have to start with a smaller effort demand and ask for myself for it to be successful. Because what we don't want is we don't want to expend ourselves to a place that and push ourselves so high that we're bound to fail, and then reinforce that paradigm of like, yeah, see, I just can't do this. I'm not good at this. I can't speak up. I don't want to advocate for myself. And honestly, it can be scary and stressful to do these things. And so that's not going to make you feel motivated, right? That's not going to make you feel like you're developing good skills. It's going to be scary. And it is acceptance of this is part of the process, and it will get easier and better as I adult more. Right. And I can speak to that because I was a young adult and I'm getting older, and it does. The things that are harder when you're younger start to get easier because you've done them over and over. And so that's why we want to start early with this population, because it's such a bigger learning curve than it is for somebody without Duchenne. There's so many more pieces you have to learn how to manage as part of your like daily care. Advocating is not just you though. There's a community around you. And it can be hard sometimes to advocate as a unified front when you're not talking. So what is it about, like, what is it that gets in our way often, when we are with our parents, our boys, adolescents, parents? Some of the biggest things that I see, and this is not anyone's fault by any means, is that our men now, 20s, 30-year-old men, our later adolescents or mid adolescents, are part of that generation that just hasn't, like, they've benefited a lot from technology and a lot from steroids and a lot from like optimizing health, their care in general. And we're prolonging life, we're living healthier for longer, but they're not eligible, they're not in the studies now going on for our younger kiddos, focused on disease progression, halting disease progression or significantly slowing it down, kind of getting some other types of adjunct therapies added into their treatment. So in that way, they're kind of like this lost generation, right? Where they were parented in a way that maybe doesn't fit where they're at now. And so these medical technological advances are rather new. And so we are living longer, but that might mean that we didn't parent in a way that the expectation is that we were going to live as long as we are now. And that is understandable. It's understandable to parent from one lens when that lens is the reality in that time frame. But that might mean we don't always have the skill sets or the expectations put on us around, like, the expectation is to be an adult or get into adulthood or get significantly into adulthood, right? Which, like, it is now, which means some of that is just the expectation there and how we've been talking about it, which we have to dig out of that hole a bit for some of you older men. But for our younger families, really learning from that and recognizing, like, it's a slippery slope for how do we support and help when we're from a dependent care standpoint, but also want to promote independence and autonomy and having a say in your life and a say in your care, because, like, those skills need to be developed, even though we maybe are very dependent on other people. The things that I hear the most that boys say to me that get in their way of talking to their parents are, I don't want to worry them or make them feel sad, right? So on their mind often are things like, what are we going to do about this? How are my parents? Like, my parents are, like, how would they take care of me? Like, how they're really busy. Like, what about their backs? Like, how's that going to go? Like, or what, like, if they want to go on vacation, like, how would I do that? And they have these big questions, big feelings that they worry about. And when they talk to you, you guys feel that because they're the worries you have for them. I don't want you to feel ostracized. I don't want you to feel like you're not included. Like, I want you to be able to go do the things. And you feel that and they see that. And what happens is they perceive that they've made you sad. You were happy, you weren't thinking these things, and then they brought it to you, and now you're carrying this burden. Not that you have the same thoughts and the same fears, and you guys just never have talked about it in a way that allows you to model adaptively, where you can say, like, yeah, dude, I worry about the same thing for you. And I know we'll do XYZ to get through it, or we'll, figure it out this way or that way. And so it's just this kind of like elephant that nobody talks about. Likewise, I also commonly hear, I worry about my parents aging and what this means for both of us, but they don't want to talk about it because they don't want to worry you, right? Because there's no way you're thinking about aging, right? So they get in this space where they're just like ruminating and worrying. And when we're doing that, we're not action planning. We're not coming up with a plan, right? We're just worrying about what if, what if, what if. And then eventually we'll need to be reactive. And so, similarly to things like sex and suicide, asking about it doesn't make it real. If it's happening, if it's going on, if they're thinking about it, if they're already thinking about it. You're not going to plant that thought. And so it's really, really important to be checking in as a family unit around, like, what are the things on your heart or on your mind? Like, what are there things that have been worrying you that you are hesitant to tell me because you think it's going to make me sad or upset? Because I bet I have the same worries and I just never told you about them. And normalizing some of this conversation to like really open that up will be really big, because when we do that, it is a very rich conversation, because a lot of times they're much more aligned and it validates each other around, like, yeah, okay, let's talk about this. We're both in the same spot versus like trying to be overly protective of each other. Likewise, why is it hard to talk to the adolescents and the men as parents? Well, you're in a really unique role and it's hard to navigate. You're serving as a parent, but you're also a caregiver. And sometimes like those two roles are competing. There might be things as a parent that you want to do, but as a caregiver, you wouldn't do or wouldn't be allowed to do, right? If you're a paid caregiver. And those can be competing. And so that's really hard. That's a really hard place to navigate. And so for a lot of families who are in this role of we're primary caregivers, we're also parents, it can be really easy over the course of time to all of a sudden find yourselves as adults where you're still serving as a parent caregiver, right? And parenting still and making decisions as a parent, even though your child is not at an age where that is legally permissible, right? Like they don't need somebody to make decisions for them, but that's what we're all used to. So that's what we do. Um, because I'm their caregiver, right? So like I'm making these caregiver decisions. But if you were a caregiver and not a parent, then you wouldn't be making those decisions for them, right? And so it's this really challenging kind of place to navigate when you need dependent care, but you also want to be a dependent autonomous person. And so that can be hard to talk about because right now you're serving as a caregiver, but like what they want to talk to you about is as a parent, like I like need this to change, which means you might have to sit with a whole bunch of stress as a caregiver to let that happen. And that can be really hard to do. There's significant have development because of that relationship that happens over time because of the dependency. And that mismatch is really, really challenging. And it's what bleeds into that kind of hard relationship. So think about how humans develop, like we develop physically and cognitively in a very linear upward trajectory, right? So as our brains and bodies are developing and we're gaining, we get access to more things and we can make more decisions. We're like going to school away from our home and we're making more friends and we can have sleepovers and we're able to make our own decisions about sports or lunches or whatever it is. And, that just kind of builds upon it. But when you have Duchenne, as that trajectory is going like this cognitively and physically, your muscles get weak and you're actually becoming more physically dependent, which means that each of these places that there should be that gap of space so that you're out there kind of developing a new skill set through naturalistic experiences and interactions with your peers, that doesn't happen in the same way. And so it takes so much more intentionality to kind of develop these things when you have Duchenne because of the nature of my brain and body are doing this, but I have dependent still on people, which is going to really impact how I develop as a dyad with my family, as an autonomous and individual person who also has some dependent care needs. And unfortunately, parents aren't always supportive. And this isn't always because of from a bad place, right? Like there are parents who are anxious and worried themselves and not supportive of somebody's goals of living independently or living with care aides because they just don't trust them or they won't take care of them as good as I will. And I'm not going to support that. That's not safe. And that can be really hard, right? Because like as a parent, that's a fair way to feel. I think you would probably feel that way if they didn't have Duchenne, right? But the difference is you couldn't really stop them like you can when they have Duchenne. And I know men who are in these situations. Um, you know, Likewise, there are parents who sometimes really rely on aspects of things like SSI and other things that people get that would be a really big loss to the unit to no longer have access to that, right? So there's sometimes these secondary motives or secondary gains associated with aspects of having a chronic health condition that's physically limiting and aging through that process. And so it's a hard conversation from both ends. It's a very important conversation to start having, but it's not always easy. And the motives behind that are very different for a lot of different people. But it's something I think we should be talking about and bringing into the space so that we can figure out better ways to be supportive to all of the community, even those that are maybe in situations or places where we don't have the best infrastructure to support adults easily and efficiently developing independence from their family units. And so we want to start by advocating to have a plan. So the first place that we always want to start when we think about transitioning and getting into adulthood and how do we advocate for ourselves is like just advocate to have a plan at baseline. Because aging adults have different needs than younger adults, and men with DMD are living longer. So you're going to start to be aging adults. And those needs are going to start to look different. And so we need to start to have a plan about how do I want to age. And your parents are aging adults, right? So that plan has to be understood in the context of your parents' plan for what they're doing as they age. We need both, right? And the more that both are done together, the better off we'll be, right? Because one is going to directly impact the other. So knowing an individual with DMD's sort of approach to long-term planning is going to directly inform their parents or caregivers' approach to long-term planning and vice versa, right? Knowing your parents will help inform yours. This is not only for your own care, for your parents' own care, but also things like how are we financially planning as a family, right? Are my parents going to need dependent care? I'm going to need dependent care. How do we think about finances? How do we think about who's going to do that, where we do that, right? Do we have to move to a home that has one floor? Do we have to find a different apartment, right? Do we need to move to a different state where we have people that can help us? Do we want to move to a different state because it's nicer, right? Even though we have social supports and networks here. Or do my parents want to move, but I don't, right? But I rely on them. So there's a lot of things that go into kind of as your parents age and are transitioning into their next phase of life that will directly impact how you think about as your early adulthood into middle adulthood and what you might need, right? Um, and that's a hard conversation to have, especially if you're, somebody that has limited resources or is lower economic status. Some of these things can be really expensive, and you have to be very thoughtful and planful around how are you going to ensure good care, safety, and sort of ability to kind of continue to live a life of quality if you need care and your parents are also needing care. That both can get really expensive. If we don't talk about long-term plans, it doesn't avoid the need for them. It just leaves you less prepared, right? And if we're proactive, we're always going to be better off than we're reactive. Because if we're reactive, we're now responding to things that are crises. And that often, maybe not often, but surprisingly doesn't always work out in the way that you want it to. These are not easy or fun conversations. So we have to accept that part of this is just, I need to develop space so that I can have these conversations over time, not try to do them once and find them punishing and then want to avoid, but something that I kind of do forever. And this might be, we talk about housing, we're talking about long-term planning, we're talking about thinking about going to college. It might be also like, I want to talk about my end of life care and how I would like, what I would want done if something happened to me and I couldn't make choices for myself. I encourage people to take this approach as a family unit and have everybody in the family kind of go through these things, right? So if you have siblings, they're involved, your parents, and like you should know your parents' wishes and what they want and like, what they're working on, and they should know yours. And my family, we do it around the holidays because that's when I'm home. My brother lives with my parent, like lives in the same area as my parents still, so it's easy for them. But when I come home, we sit down one day and we kind of go through all of our paperwork and we talk about philosophical things related to how we would, want to be cared for at the end of our life, or if something happened, and what we would want, if this happened and this happened, this happened, and not to be morbid, but just because it's an important conversation, and the people in your life that love you will carry less burden if you tell them those things, because then they don't have to guess, and they don't have to carry a burden of, did I do the right thing? Because you're probably going to have a lot of conversations about these things. And you want to, because you maybe feel a way when you're 13 or 14 that you feel different when you're 20. I hope so, right? About a lot of things. But it's still important in that time frame. Like 13, I want to know what you think about. I want to know when you're 19, I want to know when you're 26, right? Just because it's important that we're keeping that going so that people have an ongoing, continuous understanding of sort of where you're at and how you're thinking about your goals. Because we want to have a plan to live the best life possible, but we also want to have a plan to die the best death possible. And I don't say that to be morbid. I say that because just like in life, having dignity, making your own choices, and being in charge of what happens to you is just as important at the end of life. And so it's really important that we are talking about these things and we are planning around the planning. When you don't speak up, people are going to make decisions for you, and they're not always going to be decisions that you want. Right? They might be okay now, but there may not be things you want later. And that's really stressful to your parents because they're not mind readers, and they're often trying to guess and figure out what you might want or what they think is best for you. And it does alleviate a lot of stress when you can help provide that guidance. And honestly, planning for your future is your responsibility. It's not your parents, it's not your doctors, it's not anybody else's but yours. And so you do have to be actively engaged, and you do have to kind of own some of these things and be willing to be in a position that is uncomfortable. And so we really have to start thinking about how we take ownership of making decisions relating to care over time. Well, the first thing we need to do is, how do we start to approach our family? How do we start to approach the people that are important to me about doing this? We need to first acknowledge, like, what do I need to learn? Like, what are the things that I need to learn specifically or in general that will help me with this process of becoming an adult? Do I need better social skills? Is that something that I want to focus on that would help this be better? Do I need to learn how to interview? What goes into an interview? What am I looking for? What are the factors or the characters or the qualities that I want in a person? Do I even know what that is? Do I need to spend time thinking about that? Right? What is my medical knowledge? And then what is my medical literacy? Which is, again, you remember, how do I understand medical knowledge? Right? So we can give you the medical knowledge, but if you don't understand it, that's not super helpful. What are my resource needs? And what are the resources available to me? Again, what are my values? What are my goals? What do I want in life? Do I have bucket list items I want to do? Like, I want to go to Pokemon Worlds one day. Okay, great. Let's make that happen. That's a great goal. What about bucket list item? Oh, I want to see Mount Rushmore. Great. Okay. Like, that's going to take planning. That's going to take things that we maybe have to think about, but that might really be important for people to help you think around, like, how are we going to make that happen? How are we going to achieve these things? There are a lot of others. These are just the ones that tend to come up the most, that without thinking about these, can be a really hard process. Is there important paperwork that I need to complete? Right? So things like advanced healthcare directives, which is sort of like a living will or a legal document that goes into effect only in the event that you can't, communicate or make your own decisions, and it outlines what you would want, right? It's like, this is what I'd want if this happened, if this happened, this happened. Likewise, a durable power of attorney is somebody you appoint. You're like, this is the person I want making decisions for me. And you can have both, right? That they work together. Like, your healthcare proxy is just kind of like reading off the advanced directive. It's like, this is what you want. Or you can have a healthcare proxy that is just like, this is what I think they want. And I don't actually know, they didn't write it down, but I'm making decisions for them. Why this paper is important is because there might be times that you maybe know you and your family don't see eye to eye, or times that you really want to just make sure what you want is like really respected. And you might want that first document, that like advanced healthcare directive, but you still might appoint a healthcare proxy, right, who would enact that healthcare directive. Likewise, you might have a healthcare proxy that knows you really well, that can kind of make those decisions, and you trust them. If something were to happen to you, right, that defaults or defers to your spouse if you're married, or your parents, right? And so again, that's why talking about this stuff is so important, because if for some reason you don't have that paperwork, you don't have healthcare proxy, you guys haven't talked about it or those paperwork in place, but you've talked about it, they will be able to kind of navigate in a way that is consistent with what you want, which is really, really important. Who do you include? Who needs to be at the table? Is it your parents? Is it your siblings? Is it your aunts, uncles? Is it your cousins? Your family, friends? Is it your religious officials, some peers, somebody else? That's really important. Not that everybody has equal say in your life, but it's helpful to have the people that you trust, that you feel know you well, involved in conversations to help you like get that feedback and just better understand yourself from other people's standpoints, because that can help us kind of inform and be like, oh, okay, I wouldn't have thought about it like that, but that I'll have to think that over. That makes some sense about like why that's important to me. How do we start to navigate prioritizing needs versus wants? So feeling uncomfortable is not a valid reason to disengage from being an adult. I hear that all the time. Oh, well, they're just not comfortable doing that. It makes them anxious, so we don't have them do that. Okay, well, understandable. That makes me anxious when I have to do that in my doctor's office too. If they didn't have Duchenne, would you make them do it? Oh yeah. Okay, then we need to do it because it's part of being an adult, and they have capacity and kind of capacity, and they can make their decision, they can do it. And so we have to shift away from that like protection of around like, well, we don't want to make anybody uncomfortable, so we just don't make them do that. We just let them do only the things that they want to do because their life is hard. And I'm not saying that your lives aren't hard. Your lives are very hard, right? It doesn't get easier when we don't learn how to advocate and adult in the way that we want to adult. And so we really have to find our way to like be brave as parents, brave as a community, brave as patients, to like lean into allowing ourselves to feel some discomfort so that we can learn and engage in these processes that are so important to engage in once you are an adult and you are an autonomous, making your own decisions adult in charge of your own life. Who holds your power? Is it you? Is it your caregivers? Do you guys hold equal power? Do you want that? Do you hold all your power? Do you want that? Right? Things to think about. Are there things that you needed when you were younger that don't serve you anymore? Right? Like one of the common ones I see are financial things put in place to kind of help parents manage money and stay involved. And then as boys age into men, they don't want that anymore. Right? Well, that can be hard paperwork to change, right? Especially if you're an adult and you need people to help you do that. If they won't do that, then you can't get that paperwork changed, and that can put you in a really vulnerable situation. And then how do you show up to genuinely, right? So you can get your needs met, right? Understanding your values related to autonomy, independence, and goals of care is really important, because if you are trying to have a conversation with somebody to let them know what you need, let them know where you're at, and you're not doing that in a way that is honest and genuine to give them that information, they're not going to be able to be as helpful, right? That does make you vulnerable, and that can be scary, but it's needed in order for people to genuinely help you navigate and guide through some of these really harder pieces of becoming an adult. Because being an adult's really stressful. You have to learn about and own and improve upon your weaknesses, right? So if we're not good at something, we don't not do that. We have to try to do it more. We have to find ways to cultivate that skill set so we can get better at it. Doesn't mean you're ever going to love it or think you're great at it, but can you do it? Can you make it through it? Because the best way to manage stress is head on. Okay. So stress is a biophysiological process that occurs in our body when there's an external stimuli that's identifiable and impacting us, right? So a test, a lot of people feel stressed before a test, right? And we are stressed, we take a test, and then we get done with our test and it goes away. We're like, oh, I feel better, that test is done. That's stress. When that persists after that external factor is gone, like this is gone, I resolved it, and then I'm still feeling stressed, that's where we move into anxiety, okay? And so to manage stress and to not get to that place of anxiety, which is usually built around patterns of avoidance, we want to do things that are very straightforward that I'm sure you all know already, which is set goals and commit to action. You want to start small and you want to adhere to the plan. So if you're like, I'm doing this tomorrow at 10, we do it tomorrow at 10. Or if you have a schedule like every day from here to here, these are the time I work on this and then I work on this. I call this place to try to get some paperwork done. I might spend some time looking something up here. Then we have to do that on that schedule. If you skip it once, okay, everybody has a day. But if you skip it more than once, now we're starting to get into a pattern of avoidance, and we need to squash that, right? So sometimes it's just holding yourself accountable, like, nope, I skipped yesterday. I can't allow myself to do that because I don't want to get into a pattern of not doing this. The other rule I like is the rule of 5 to 10, which is sometimes you just set aside 5 to 10 minutes. You're like, I'm just going to try to get engaged in this task I need to do for 5 to 10 minutes. If I'm not engaged and kind of going at the end of that, I'm allowing myself to stop, do something else for a couple hours and come back to it. It's not that we don't do it. It's just that we take a break and we come back to it. What most people find is this approach either helps them not get stuck, because if we stay in that space, we're actually kind of training ourselves not to move past that barrier. But what a lot of people say is like, oh, I actually got it done in that time. Or like, I just got into a good rhythm and I kind of wasn't thinking about it and I was able to just keep going. And that's the function of that. That's what we want. Start easy, build momentum, do the tasks you can do without help first. Everybody is going to be better at helping somebody that's already helping themselves. Okay. It is hard to help somebody that isn't putting the effort in to help themselves. And so the more help that you want, the more you need to demonstrate to other people that you are trying and doing and helping yourself. We also need to acknowledge and label stress, right? So if we don't do this, we get in those insidious patterns of avoidance, and it's not actually strong to do this, right? Pretending to be okay isn't strong. That's lying. Being strong is saying, I feel this way, I don't feel great about it, and I'm still choosing to do these things that are adaptive. I'm still making these phone calls. I'm still completing this paperwork. I'm still going out to have coffee with a friend, whatever it is. And so it's really important that we're being honest and like acknowledging, like, even if it's just like, yeah, I think I feel stressed about this, and that's it. That can be huge. Because stress can be a motivator, right? Because remember, if we alleviate that external factor, we should feel better, right? And we can say things to ourselves. I know I'll feel better when I complete this. In the past, when I felt this way and I've completed it, I felt better. I'm not going to allow myself to do something like play video games until I get this thing done. And then you have to hold yourself accountable to that, right? Because it's not like, there's no way that you're going to want to play video games all day and then stop doing that and then do this thing that you didn't want to do earlier in the day. That's just not how it works. And we need to start to shift away from this need, this want, not want, to need, not need to do. Okay. So it's not about what we want to do when we're adults anymore. That's the thing, right? Like it is when you're a kid. A lot of people are like, well, I don't really like doing that. They don't want it. Their life is hard, so we won't make them. But as an adult, you don't get to do that. Like, I don't want to pay bills. I don't pay my mortgage. I don't want to, but if I need a house over my head. I need food. I need to, pay my other bills. And so there are certain things you just need to do, not because you want to, but because you need to do, and you can make yourself do, because you've cultivated the skill set of making yourself do things you don't want to do that are hard and uncomfortable for a period of time. And that's just up the ante on the demand until you're in your adulthood. And now all of those demands are on you to manage. Right. And so really spending time to think about, like, where are my weaknesses and my traps that I need to know for myself? And what do I need to start doing in my teenage years to really help with that? And as parents, it's like, what does my kid need to really help with these things so that we can set them up, that they can be successful, living the life that they want as an adult without significant, involvement from a control or, taking away autonomy standpoint. Thank you.
Awesome. Thank you so much. I think that, something that I'm coming back on, something that we, talk about a lot is, transition and what to do. And I love, that we're talking about younger ages for transition, because I think that's something that people don't think about a lot, is how young we need to start looking at transitioning. And, like you said, taking responsibility and advocating for yourself and really taking responsibility for your life. So thank you. If you do have any questions, please feel free to either put it in the chat or in the Q&A box like we talked about. We are also streaming the Facebook, so we will try to get to any questions that come through on there. I'm actually going to pull it up right now. But I'm going to give everybody a second. I know that it sometimes takes time to formulate those thoughts and those questions, but while we're doing that, again, Dr. Truba, thank you so much. I think this is such a needed topic and such an important topic for the entire community, and especially those transitioning. So thank you, thank you, thank you.
Thank you for having me. I love that we're starting to talk more about these things, because like we're working in the dark right now, and without the men and the families involved with doing this better, like we're going to continue to be in the dark as our boys age and our men age. And we're really in a place that we should really be putting effort into thinking about how do we live the best life as adults with Duchenne.
Absolutely. We do have a few questions. What's the best way to address changing increased lifespan expectations?
Oh, yikes. Should start off with a big one. Okay. I think it depends on the family, and I think it depends on the kid. I think we have to be honest and we have to be realistic. And I think there's still a lot of questions out there around like cardiac function and other things. And so I think we have to acknowledge that we are going to have longer lifespans, right? I don't know if that necessarily means longer as in quantity is equivalent to quality. And I think that that's a place that we're going to be finding ourselves in, that I think is going to be kind of challenging. Because we haven't really flushed out some of the things that really can contribute to quality. And we don't want, to extend life so that we're extending into things like pain and suffering, right? And that might be part of life, right? Like life will have some pain and suffering. But if that's the only thing we're kind of doing, like that is not ideal. And so I think we have to be very thoughtful as we talk about, yeah, we're going to have longer lifespans. But is that the only goal, or do we have these other goals of like increasing quality for our adults as well? And I think I think one conversation forms the other, and I think they both have to be had. So I think the expectations management around quantity also should include the conversation around quality.
Absolutely. How would you suggest speaking with your family around needing privacy in the home and during clinic visits as you hit puberty?
Well, first off, I thank you for that question. I think that shows a lot of bravery. I think if you feel comfortable asking your family to be like, hey, I would just like a few minutes with my doctor by myself. I'm going to ask you to step out, or, hey, when we go in today, is it okay if I go in by myself for a little bit and then they come get you? Right? Because sometimes it could be weird to leave after you're in there. Those would be two ways that I think if you're comfortable and your family's receptive, that could be helpful. I think if you're not comfortable or your family's not receptive, there's other ways. Like you could probably message clinic using my chart or something like that, and ask them like, hey, can you guys bring it back? Can you ask my parents to leave? I want to talk to you about some things. I think us as providers have to put a lot of this on us too, right? Like we should be asking parents and families to step out, asking them to step out when kids are like 13, 12, maybe even younger, depending on your discipline or your specialty, so that we can make that space and like model that is the expectation. I remember that being part of my doctor's visits when I was a kid, right? Like my parents were asked to step out every time. And I know that we don't always do that in clinic. And so I think some of it is, on the parents too, to be like, hey, do you want me to step out? Or I'm just going to step out because I just want to give you space and not asking, because sometimes that can be hard to navigate. So I think it's their responsibility on everybody.
Absolutely. Do you have any advice for parents planning their children's financial future?
I would involve your child and I would help them. I would really spend a lot of time making sure that they understand like the conceptual why behind your financial planning. Do you work with somebody? Could they be involved in that? Right. If it's a family based sort of financial planning situation, maybe trying to work with the same fiduciary or financial advisor in a way that allows for like familial or intergenerational finances to be managed concurrently or in a way that helps inform each other. So if if they know kind of where your goals are as a parent, they can kind of help guide and support your child as an adult while you're also helping guide and support them as an adult. But I think those conversations of finances again also need to start really young and helping them understand um, the role of financial planning, because you want to be thinking not only for your care, right? Like what you might need as an aging adult, but for their care and around type of housing, right? Are we looking at a facility like some sort of independent living, assisted living facility? What does that look like? Are there any in your area that have younger adults, or is it only a lot older people? Is that even a fit that they want? And otherwise, are we looking at maybe a home or something like that where we can have paid caregivers? Because that's going to be a totally different financial expense. Is it something all different altogether? Do we have siblings involved or other people that are willing or want to step up? And like, then what does that mean for them financially and that burden that they might have to absolve or carry? Do we want that, or can we financially plan for that? And so that's where I think having that conversation with your son and then with your family as a unit is really important, because I think it's really hard and impossible to do that if you don't know all those other factors. Like what actually does your son maybe want in life, and like what are these other factors and how make that contribute? And so that's a hard question to answer without like talking to you individually. But I would be very much thinking about like the goals, the values, who else might be involved, and how do we think about this over time, not only for yourselves, but like for your relationship to your son and yourselves, because you're both going to be maybe in a position that's not ideal around similar times.
Perfect. Another good question. Several adult Duchenne patients have mentioned sexual needs when chatting. Do you have any advice on how those might be met?
Yeah, I think sexual needs are a huge gap in our conversation in the Duchenne community. Um, I think that can be a really understandably awkward conversation to be having with your parents, especially when you're talking about like, how do I get my needs met? How do I explore things? How do I understand my sexuality? I think that's another role for clinics and physicians and psychologists or social workers that are there to kind of help try to like navigate and help understand and help you figure out, how do I how do I talk to my parents about this, or what is a way that I might be able to assert myself in this way to kind of explore this thing and have my parents be supportive of that, or do I need to start to think about maybe I have to hire different caregivers, right, that aren't my parents, so that I can have a different type of relationship and hire them, and that be part of my question asking, like, how comfortable are you supporting things that I might need sexually. I'm not saying do sexual things to me, but I might say like, I want to go out and go on a date, right? Are you willing to help support that? Or, how comfortable are you in situations in a dating capacity? And that might be a part of your interview skill set around finding the caregiver that is a good fit and a comfortable fit, and somebody that supports you in like doing the things you want to do in a way that's comfortable, right? Because that might not be comfortable with your parents. But you know, I think we have to have more conversation and really engaging our community around like, what is it, like what are those needs, like how are you guys going about that now, like what are the ways that we could kind of think about either adding in safety or adding in alternative explorative options depending on your state you're in. And so I think there's a lot to discuss in with regards to sexuality and gender and intimacy.
Thank you. And then last question that I have for now, and I'm not sure the answer or if you can answer this question, but what are your thoughts on finding jobs that Duchenne patients can do in their teens to potentially increase future Social Security payments?
I think it's a great idea. I think it's a great idea to try to find jobs that men and adolescents with Duchenne can do. I think it takes creativity. I think it takes getting out there and feeling comfortable having people say no or be unwilling to be flexible in how they think about it. Some of the adolescents I know that do have jobs, they may not be jobs that you would think of or jobs that you think that they could do, but well, there's a will, there's a way. And, with the right employer, they can kind of find a way to incorporate and build the skill sets that they do bring into the workforce. I think this is why we want to start early and young with our men and our boys about like, what are the things that they enjoy doing and how do we turn that into a way to make money or think about having livelihood. So, they're really good at certain things like computers or, um, using technology, and some of them are just wicked smart and some of them are hilarious and so there's a way to find something that is doable, maybe that be tutoring, maybe that be coding, maybe that be, writing letters, maybe that be editing, maybe that's, you're pushing trash cans with your wheelchair on wheels because like we figured out how to do that where there's wheelers. So I think it's really important. I very much encourage it. I think that it takes some creativity and flexibility and willingness to expose yourself to some disappointment and people being rigid thinkers that feels bad. And that's not a reflection of you, that's a reflection of them. And you have to have that mindset around like, this isn't about me. This is like, you're just not creative and you can't figure this out. Like you're lost, right? Like, can you lift 50 pounds? No, right? But are there every job? Do you have to lift 50 pounds? I can't tell you the last time I lifted 50 pounds in my job, probably never. Right. So like, I think that it's really about like exploring and pushing us to explore into areas that maybe we don't always want to explore or feel comfortable. But you don't know what you don't know until you try it.
Awesome. Thank you, thank you, thank you again. If anybody does have any questions that they think of after the fact, please feel free to send them to alexa@jetfoundation.org. I will be happy to get them to Dr. Truba to see if they are a question that can be answered. Remember, it really is more general. She can't really get into specifics, but she would be happy, to answer those general questions. So thank you all again for being here. Please join us for our next webinar next month. Dana Edwards will be talking about the perfect cliff. So we hope to see you again soon. Have a great day, everybody.